Let's look into how traditional medicines help with pain management.
Each channel run through the organ. The lung channels run through the lung organ, and it control the respiration and circulate defensive and protective energy. And the spleen help transform and transport food and turn that into energy and blood. The liver rules the sinew system, which is responsible for the smooth flow of qi and blood. And the heart primary channels is rule the blood vessels and is control the mind and the spirit. And the kidney influence the bones and the joint, also the ligaments. In traditional medicines, when we diagnose it, we're always looking for the imbalance, excess, or deficiency. Acute injury is considered as excess, which can produce a result of localizing pain, bruising, swelling, inflammation, limited function, and proprioceptive dysfunction. This may include lack or improper treatment, underlying channel organ pathology, for example, like diabetes or high cholesterol, that have compromised the body's ability to fully disperse the stagnation and restore the proper function. So depending on the severity of the injury, the extent of inflammation process, to any tissue adaptation that occurred during the healing process, the proprioceptor may remain injured and dysfunction. The proprioceptors dysfunction occur when proprioceptors are unable to connect or reestablish the normal communication with the central nervous system. As a result, this proprioceptive dysfunction is the obstruction to the primary or injure the channels. So here, this is the sinew system, and is connected or circulate by the wei qi, which we call the defensive or protective energy. It is the most gaseous, non-material type of energy, and is connect with a breath pattern, which link to temperament, habitual inclination, and is comprised of muscles, tendon, and ligament, and that held together by the fascia system. The fascia is the band or sheet of connected tissue, which primary collagen and the hyaluronic acid, it helps lubrication and help the fascia tissue to glide over to the neighbor muscle tissues. So active movement help bring the dynamic into the tissue. So the body reshapes itself by depending on the force it's subjected to. So by stretching and massaging, it can help realign the collagen fibers, and it can take up a year for the agglutinated tissue to regenerate entirely or properly. Other activities that people can do to help produce healthy primary substance are exercise, wholesome diet, great gene constitution, ability to manage stress, satisfying work, and also balance mental, emotional, spiritual life, and most importantly, strong social emotional support network. So this is the sinew channel. It's govern movement and sustain posture. And the physical injury to the sinew channel are often by overuse, traumatic injury, organ imbalance, and climate. And self-preservation can also injure the sinew channel. The somatization can block out emotional pain, numbed out, and can block the emotional input. And here's the exoplasmic flow. It is an axonal transport responsible for movement of mitochondria, protein, and order organelles. So exoplasmic flow is similar to what we call in traditional Chinese medicine is qi and blood stagnation. So in the traditional medicine, the binding region, the knot, are considered, it can press against nerve, and it can create a myofascial adhesion, and over time that build up, that can compress on the nerve, and then we get nerve impingement. And as you can see, the first line is a healthy exoplasmic flow. The second one we can consider as acute. And then the third one where it gets into the latent, and that will be sometimes harder to reverse. So overuse and repetitive activity decrease the chi and blood flow in the channel. The technique of the acupuncture's position, depth, and location are important. In the picture to the right, so when you see that pink dot around the needles, it means the needle was able to hook on the chi, which we call like the force, and sometimes it gives like a tingling, dull pressure kind of sensation. But this is where it's kind of help deactivate part of the limbic system in the brain. Circulation. Lifting, thrusting, and rotation help bring the microcirculation underneath through all the layer muscle where the needles is puncturing through. Here's electrical acupuncture. The frequency, intensity, and treatment durations are important. The frequency, all of those are depend on the patient nervous system. And the treatment duration usually 20 minutes to 30 minutes. Once in a while, I have a patient that require more just because they feel like they were able to relax and sleep during the treatment. Then I can leave them a bit longer. So electrical acupuncture activates the sympathetic nerve fiber to increase endogenous opioid in inflammatory site via two pathways. One is to activate the sympathetic nerve fiber to enhance the migration of opioid-containing cells to the site. Two is trigger HPA to decrease COX-2, which in turn interfere with endocannabinoid metabolism, leading to increase the level of opioids at the site. So here in one of the research with the Dutchy sensation, they put the needle under the low frequency electroacupuncture at the stomach 36, which is by the knee area. And as you can see, the deactivation of the limbic paralimbic neocortex network across multiple levels of the brain, color in blue, and the sensory motor system activation is colored in red. So self-care is very important in conjunction with acupuncture because exercise, lifestyle, and nutrition are shape the way our body is. When the patient come in, I'm not just looking at the patient, treating the patient pain, but I'm trying to look at body imbalance. And the tongue and the pose, it's really show me what I can help advise them to do. So as you can see, the first two pictures on your left side, the patient have more yin problem. The first one is more heart, the second one is more liver. What that means is dehydration or overheat in certain organ pathology. So the first one, he tend to have easy anxiety and stress versus the second one have PTSD and recurrent nightmare. So those are the patients I will suggest them to sleep on time, eat on time, and be mindful, and do cut out the caffeinated drink, and also alcohol, especially alcohol. And the second two picture, as you can see, the tongue is a bit swollen. That's where the diagnosis is more like yang deficiency or spleen qi or dampness deficiency. And these are the patients I ask them to add more probiotic, take care of their gut, make sure they have bowel movement every day, and cut out all the mucus forming food, which we call damp food, like sugar, carbs, and fried processed food. So basically, overall, traditional medicine approaches chronic pain management holistically, addressing not only the physical symptom, but also the emotional, mental, and other aspects of health. So it is very essential for the patient to work closely with the healthcare professionals to find the most effective combination of treatment for the specific need. Thank you.